Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Today I will talk about breaking bad news in MRCPCH communication station. So this could be the difficult for some candidates. So any scenario with breaking bad news, what information you should give and how to approach and how to communicate the breaking bad news in exam. So breaking bad news, as you know, I will tell you about in all breaking bad news, you should follow some protocol, and also at the end, I will talk about the Down syndrome on newborn baby who has features of Down syndrome, how you should tell the mother and what mother can ask you. So before I going to start, please subscribe my channel for further informative videos. So breaking bad news in all scenarios, you should follow the talk about the new information. For example, you have introduced yourself, you make the repo, and you ask for the attendant, and then definitely you are asking the next question what already they know about this information. And if you are giving the same information, because examiner is watching what information you are giving, it depends on your knowledge. For example, if already they know about the Down syndrome, you should start to give the information what information they don't know. Do not give the same information already they know. And then you should talk about the implications. This is for all any breaking bad news. Talk about the implications they want to know. They want to know the new information, what they don't know. And then when you break the bad news, definitely at that time you give them space. You give them space, parents or patient, to respond how they might respond. Every human being is responding in the different way with the breaking bad news. So they are expressing their feelings and you don't know how they feel. Some of them they start to cry, some of them start to shout, some of them they're asking questions. So if they start to cry, offer them a tissue paper, be polite, be calm, and just keep patience. Do not interrupt, let them to express their feelings and let them to ask the questions. When they it takes some few seconds, so be quiet and do not in rush to give the all information on one go. And then answer their concerns honestly and sincerely. Do not give any information which is wrong information or you don't know about that condition. And if you don't know, it's better to say I don't know. We will arrange another meeting, I will ask, I will read, or my senior can tell you. So it's better to give this answer. Wrong information is not applicable. Wrong information is not allowed. So give the information, correct information, and honestly and sincerely. So breaking bad news about what is going to happen now. You told them about the implication, what is going to happen now. Give opportunity for more questions again, because you gave the information, let them ask the questions again. Initially they ask you about what is this and this thing, you give the information about that condition. Now give them again offer, give them some space to ask you more questions. So definitely whenever you are giving information, this is the rule that if you are giving anyone bad news, so first meeting they will not get even 50%, even less than sometimes 10%, 30%, or sometimes 20% they will get information in the first meeting. After they are accepting, they're absorbing the news, maybe after a few days, if you will arrange another meeting, then you whatever information you are giving them, that is more appropriate, and that time they are in the listening mood and they want to understand. But initially you have to tell them what information is correct and you have to tell them about the information and give them opportunity of questions. Offer another meeting. As I told you, the first meeting is they will get little information, because it's human nature. And first when they listen the bad news, definitely it is a storm in their mind, if especially if it is the loved ones. And after that second meeting they might get the more knowledge from you. So at the end, definitely you will offer summarize, and then offer the leaflet support group if it is appropriate. So this is for all breaking bad news scenarios in the exam setup and in the real setup. So after that, example of Down syndrome. So for example, a mother who has a baby, newborn baby, and born with the Features of Down syndrome. On your initial examination, newborn baby checkup, you find that he has features of Down syndrome. Now your task is to give the information to the mother that your baby has features suggestive of Down syndrome. Please read carefully the scenario, because Down syndrome confirmation by genetic testing, right? So newborn baby checkup only by the features. So you cannot tell the 100% your baby has Down syndrome, but features are suggestive of Down syndrome. We will send the blood workup for further confirmation, which is genetic testing. So this thing you should read in the scenario, what information they already know and what you want to give them. Now, for example, you have introduce yourself, you make the report, you congratulate the mother about the newborn, you ask about how was your labor, and then you will ask about the attendant, you ask what mother knows already about her baby. But after that, the immediate you should tell the mother, on our newborn checkup we find that your baby has features which are suggestive of Down syndrome. Now you break the bad news. Stop. A few seconds to stop. Let the mother to react about your breaking bad news. So definitely she will react, and everyone is reacting in a different way. So whatever she is give you a reaction. If he is starting cry, and give the tissue paper, and let to be situation calm, let to ask the question, then definitely she will ask what is Down syndrome. Then at that time you ask about the previous knowledge. Have you heard about Down syndrome? Have you seen any baby with Down syndrome? Sometimes common, many people nowadays they know what is Down syndrome. So maybe they have the family members, so whatever the information they give you, yes we know, then you will start from there. And if they don't know, you should have to address what is Down syndrome, and it's a condition. It's a condition in which, for example, we all are content have 23 pairs of chromosome, and pair means which total number of chromosome are 46. What are chromosomes? It is a chromosome. Definitely, this is responsible for transfer the information from parents to the offsprings. So this is thread-like material which is responsible for transfer information from parents to offsprings. You cannot tell them the genes and these thing information definitely is not for them. So you should have to tell them information without jargon. And in the condition of Down syndrome, the 21 number of chromosome has the extra copy. So instead of 46, they have the 47 number of chromosomes. So that's why we called it the Down syndrome. Okay, so they have definitely, now she might think about the future of the things. Maybe she will ask you, does it runs in the family? Is it my fault or my parents' fault? Does it run in the family? No, it doesn't run in the family, but it increase the risk when the mother's age is increasing. Increase the risk by increasing mother's age. Okay, and then she might ask you, is it my fault or my parents? No, it's no one's fault. It can happen with anyone. It's by chance, right? And when mother get older, the chance will be increased. Okay, so now you gave this information. Next, she wants to ask what will happen. What is Down syndrome? Down syndrome will have some level of learning disability. Now you are telling about the Down syndrome in the child, what your child might get. They might have the learning disability, but the people with Down syndrome, many Down syndrome children, they live the independent life. They do they get the education in the normal school, mainstream school, and also they get the job. So give her some hope. But like everyone who has Down syndrome, they have their own personality. They things like and dislike their own, and also they make them their things that make them who they are. It's their own personality. They definitely they will their own personality, and disliking, liking, thinking, cognitive behavior, all these things is their own. So this information you should give to the mother. Okay, so as I told you, then mother might ask, when I was pregnant, I did why didn't you get it before? For example, during my anomaly scan, during my pregnancy investigations, why didn't you get it before? Why didn't you tell me before? Yes, we offer the anomaly scan. We do some tests, but it's not, these scans and tests are not 100%. It can be missed. So usually, what about my next pregnancy? She might ask, what about my next pregnancy? Me and my partner are expecting more children. What will happen about our next pregnancy? Yes, for next pregnancy, as I told you, it doesn't runs in the family, but we will do the ultrasound scan, and we will do some test at 10 at week 10 and 14 of pregnancy, some blood test which can tell us about that this your child is in your tummy has Down syndrome or not. So that is the screening test. So these information you can give, and after that definitely you should have to give the summarize the case. And whenever you are giving breaking bad news, their thoughts would be like a storm in their mind. And some of the candidate, they want to give them a lot of information at one go. Some of them, they don't give, they want to give them a chunk of information. So chunk of information is very good, and definitely you will tell how it will be confirmed. We will send the blood test, and we will send some blood test for the confirmation of the diagnosis. The result will come within few working days. Okay, and as you know, the other complication of Down syndrome, you might tell, it's okay that you will tell that babies who has Down syndrome, they might have problem their hearing, and they might have a problem in their thyroid function, they might have problem in their heart. But don't worry, we have good team of doctors. We will definitely screen for that, and we will follow all the team of doctors. So effective communication make them calm and make them to understand. So effective communication is very important, even in the real life with everyone, but in the exam they want your effective communication. Examiner will watch out how you respond. Examiner will see how what information you are giving them. Examiner will see, is it appropriate information at the appropriate time, or you want to give them all information. This is the communication station. It doesn't mean that you will tell them all the book. So you have to give them the information in chunks, pieces, and let them to listen, and let them to ask the question, and then effectively give their reply of those questions. So if you want to attend the MRCPCH clinical course, you can email me and register your name, and it would be effective. And if you are a beginner, it will be more effective. It's a 2 months course, and it will help you to pass the exam. Thank you very much.